Hello everyone, my name is Robert. I'm a nursing student for Nightingale College. Today I'm going to be performing a video skill which is changing a central line dressing. Um, Going over my supplies real quick, I do have my hand sanitizer there in the bottle. Next to that is a trash. I have a disposable pen. I have my central line dressing kit. I also have my disposable gloves here, and I have 2 masks. Just to catch you up, considering that this is a remediation video, because I have to remediate, I was advised to just kind of skip ahead. So let me go ahead and give you a quick preview of where we are. So I already checked the doctor's orders. I came into the room. I introduced myself to Mr. Jones. I explained to Mr. Jones why I'm here. I went over and I provided privacy. I did my hand hygiene. I washed my hands. I came back. I verified Mr. Jones' ID with 2 sets of ID by having him verbalize and confirming the information that's on his ID band. That was good. As I said, I already explained to Mr. Jones what's happening. So I'll go ahead and get started. And usually in this kind of procedure, you want to make sure that we follow all clean techniques. So normally, either the patient can turn his head to the right or to the left or look away while we're doing this procedure, or we can give the patient a mask. Mr. Jones chose to wear a mask. I thought that was a good idea. So I'll go ahead and do hand hygiene first. Clean my hands, right? Then I'll put on my mask first, right? Good. My mask is on. I'll go ahead and put Mr. Jones' mask on. Okay, Mr. Jones, here's your mask. Good. Make sure his eyes are closed. Showing. Okay. Good. Now what we're going to do is I'm going to go ahead and do hand hygiene again. Now I can put my gloves on after doing hand hygiene. I'll go ahead and put my gloves on. Okay. Good. Now that my gloves are on, I'm going to stabilize the catheter tubing. So with my non-dominant hand, and then I'm going to work on pulling up the dressing, the old transparent dressing, by stabilizing the tubing. Now when I pull up this dressing, it's important that I'm doing the corners first. I'm going to be looking, lifting up, pulling up and inward towards the site, right? We want to make sure we get the edges first, up and inward towards the site, parallel to the skin. Making sure we're stabilizing that catheter though. That's very important as we're pulling this up and inward towards the site. Right, good, got that off. Let's get rid of that one there. Now that that's off, now what I'm going to do now, I'm going to be inspecting this site. I'm going to be inspecting the condition of the actual site where the catheter is going into. Also, I'm going to be inspecting the skin around the site. I'm looking for redness. I'm looking for skin irritation. I'm looking for signs of infection. I'm looking for swelling. I'm looking for drainage. I'm looking for I'm even using my nose to see if there's a certain smell to it, right? I'm also going to be palpating, right, for tenderness. But not only am I palpating for tenderness, but I'm also palpating for the temperature of this site, right? Just to make sure there's nothing going on here. I'm going to ask the patient, does this hurt? Do you feel any kind of form of tenderness or any soreness here? Right? Because I need to document that. I need to communicate with the healthcare provider on that as well. Right? So the patient states that everything looks okay. The catheter looks good. It's intact. There's no kinks in it. So that's good from there. So what I'm going to do is I'm going to get rid of these gloves. Right? Let's take that. And we're going to take this gloves. And we're going to dispose of those gloves. I'm going to do hand hygiene, right? Hand hygiene. Now, I'm going to open up my central line dressing kit. This is the sterile techniques we're going to be using. We're going to open this up, make sure it stays open, right? I'm going to only take the gloves out, right? The sterile gloves. Just make sure that stays open. It keeps coming back, but okay, good. We're going to open the gloves up. Put those on the table. We're going to use the 1-inch border. We're going to pull these apart. Okay. Now, I'm going to put the glove on my non-dominant hand first. I'm going to just grab the edge of the glove. Okay. I want to make sure we always got to find that thumb. That's always the hard part. The thumb and the pinky. That one's in. Now I'm going to use the cuff technique. I'm going to cuff with my non-dominant hand and cuff the actual glove here. Slide that on. Hands are good. I want to make sure I keep my hands in front of me. I don't want to touch anything unusual or anything that's going to contaminate my hands. So what I'm going to be doing now, I'm going to be grabbing the chlorhexidine scrubber. There's on this device here, we're gonna pop the clamps on the side just to open it up, and we're gonna grab the forceps. Right, we're gonna use this here. So the key to this one here, we're gonna, as I said, we're gonna pop the clamp on the side to open it up. Also, we're gonna make sure that the sponge here on this device is soaked up with the chlorhexidine cleaning solution, because that's how we're gonna use it. And with this device, the way we're gonna clean is, we're gonna clean in a back and forth motion, right? But we wanna create some friction with this device. Right, so we're going to clean all four sides, back and forth, all four sides, underneath, all that good stuff. So, and then with the forceps, I am going to grab the edge, I'm going to grab the tubing, the edge of the tubing. Good. We're going to grab the tubing, and we're going to just clean. We're going to go back and forth, right? Clean for 30 seconds, back and forth, right? We're going to create some friction, back and forth, create some friction, back and forth, create some friction, and back and forth, create some friction. Now it's important that we're cleaning the size of what the new dressing is going to cover up, right? That's the areas that we're just cleaning. So we're cleaning back and forth. Now, we want to clean underneath the tubing, right? And we're going to clean the top of the tubing, right? And we're going to gently put this down. Good. We're going to dispose of this one. We're going to dispose of that one. Before we put anything on it, we want to let it dry, right? We want to make sure that the chlorhexidine solution has dried before we put on the new dressing. In the meantime, I just want to go over that if this would have been an alcohol swab, we want to make sure that cleaning with an alcohol swab is a little different. You're going to start from the center, circular motion, working your way outward, right? With an alcohol swab, that's how you'll clean with that. As I said, with the chlorhexidine, on the other hand, this one, because we have that chlorhexidine scrubbing pad there, we want to make sure that we created some friction, as I done, cleaning all four sides, and also the cleaning should last about 30 seconds, which it did, right? So now this looks dry to me. We're going to go ahead and take the brand new Tegaderm. We're going to peel that off, the brand new Tegaderm, and we are going to cover this up. We want to make sure that we have a visual on the actual catheter site, and make sure that the tube is in a good spot. Right? Make sure the tube is good. Right? We want to get rid of all air bubbles there. Now we can go ahead and peel it off. We want to be able to see the catheter site. That way, if there's anything forming, any pus, we'll be able to look at that and be able to document that and communicate with the doctors going from there. So we're just going to unpeel the edges on this transparent dressing, this Tegaderm dressing. All right, we're going to go ahead and pull that off. This is the side that has the tape on it. We want to make sure we save that. And want to pull off the other edge. Still want to make sure that we are taking good notice and care of stabilizing the catheter. Just throw that one away. Now, with this one, as I said, the side that has a tape, I'm going to use this disposable pen. I am going to put today's date and the time, also my initials, right? The reason for that is so that we can keep a form of team communication. So the next person who comes on, they know when this was placed on. And due to our facility policy, we're going to follow that on when it needs to be changed, right? Okay. Let's take this tape off. Good. We're going to put it along the edge of the transparent dressing because we don't want to cover up the site. We want to be able to always have visual to that site. Right, so then we're going to take this pen, disposable pen, get rid of that. Right, we want to get rid of all of this stuff, clean up this stuff, put everything in the trash bag. Everything in the trash bag here. Okay, put that trash over here in the trash can. Then I'm going to get rid of my gloves. Right, get rid of my gloves. I'll also put that in the trash can. Okay, now I'll do hand hygiene. Hand hygiene. Right, hand hygiene. Take off my mask. Put that in the trash. I'll do hand hygiene again, one more time. Take off the patient's mask. Here you go, Mr. Jones. Your mask is off. Right, put this in the trash. Now, I'll make sure Mr. Jones is comfortable. I'll give him the call light, ask, is there anything that you need? Everything's good? Okay, please let us know if you have any questions. Then from there, before I leave, I'll go ahead and do hand hygiene, go wash my hands, and I will then go document the procedure that just took place. Right? Thank you very much.